Hey guys, in today's video, I want to share a message for someone who will be having a surgery for their very first time. Now, for me, I had my very first surgery at the age of 1.5 years old, and that was through a muscle biopsy. Now for me, and that muscle biopsy was because I wasn't walking, I wasn't standing. Milestones that my twin sister was able to do, I wasn't, so it became a concern for my mother, like, hey, what's going on with my son? And long story short is they did a muscle biopsy to then later find out that I was diagnosed with SMA type 2, that I was then diagnosed with SMA type 2, which is a progressive disability that slowly takes away the ability to walk, eat, and breathe. So that surgery really doesn't count to me because I was young. I have no form of memory of it. But at the age of 10 years old, at the age of 10 to 11 years old, it was in 2010, so I was 11 years old at the time, and I had my very first major spinal fusion, which is a surgery that was 14 hours long, and it was because I had developed severe sclerosis, which is curvature to the spine, where it became a health concern, crushing my organs, and which is why I needed a spinal infusion. So spinal infusion is essentially, I had severe sclerosis at the time, and a spinal infusion is where I won't try to go too much in detail, but they open up your back, they cut your back, they open it up, and they instill metal rods within your spine to straighten you up. So you no longer lean, which as I am currently, and so you no longer lean, you are sitting straight up. So that was a success for a very short while. So up to my knowledge, it lasted only a few weeks. My mom says I had it in for like a few months. I don't remember that, but she could be right. I was young. And long story short is I had developed a severe infection where I then needed a spinal debridement, which is now they had to recut me up, take out the metal rods. And because of this severe infection, it caused me to go in and out of the OR for Monday through Friday, several weeks at a time. I was hospitalized for 2.5 months because that's how intense and severe my infection was, and the severity of the situation that I was currently in. At such a young age, I was going through this. So this may not be the greatest, because the title of this video is a message for someone having surgery for the first time. Is the reason why I am sharing this with you is because I want to share with you that I am very well experienced when it comes to surgeries, when it comes to anesthesia, it comes to sedation, and I know that's probably not the greatest story that I should have started with, because it was quite intense, but I wanted to share that story with you to let you know that I am very experienced and knowledgeable when it comes to having surgeries. And I was 11 years old at the time, so as you can imagine, I was young, I'm scared, I'm terrified, and you're scared, right? You're young, you don't know what really is going on, because you're a kid. But my message for someone going through surgery for the very first time is, don't be afraid to ask questions. Don't be afraid to be that individual. Depending on, there's a difference between like surgeries and procedures. Surgeries is when you're under anesthesia, and procedures you can still be under anesthesia, but up to my knowledge, you are more sedated than put to sleep. Up to my knowledge. Now, when you're having surgery for the first time and you're going through anesthesia for the first time, of course the doctors and the medical professionals will tell you the risks that are involved with your procedure. And I want to share with you that they have to tell you the worst case scenario. They have to. They don't do it to scare you. They do it because they have to share with you like the risk and the worst possible scenarios that can occur. But if you are an individual who you know you need this surgery, whatever it may be, try not to focus so much on the worst possible outcome and have faith on the possibility that after you wake up and after you get through the recovery process, you will begin to feel better than you were previously. Do your diligence with the surgery and why you need it. And I think if you're an individual who is having surgery for the first time, and you know you are in good hands, like the hospital has a good reputation with taking care of their patients, that's like a good indicator for me that you are in good hands. And don't be afraid to ask questions. Hey, will I be asleep during the process? What's the recovery process going to be like? After, in the morning, you say I cannot eat or drink after midnight. What's the latest time I can eat something, drink something? When I come in the morning, what's going to happen? Am I going to see you, doctor? Yes. Majority of the time you do see your doctor before you go into the OR, but sometimes the doctor is a little bit too busy, but they will send, people part of the team and that are involved with your case and who will be involved in the OR with you will come and see you prior to the surgery. And don't be afraid to ask questions. Hey, what's your name? Don't be afraid to double check your name and verify your medical ID number and verify your information. And for me personally, is every procedure. I was young, but yes, I did do this, and I still do it till this day. Whenever I have surgeries or procedures, I always see my doctor before I get put to sleep. And the reason why I do that is because I want to make sure, I am in the right room with the right team who is well aware of what it is they should be doing or, should be doing for you. You know what I mean? Maybe I'm just a little bit paranoid, but that's just how I am. I like to see my doctor before my procedure, and you do have that right to do so before you get put to sleep. But try not to, go in. I know when it's your first surgery, you're nervous, you're scared, depending on the severity of your surgery, especially if it is something that is going to be several hours. Try to ease your nerves and calm your nerves, and try to keep yourself in positive spirits. Try to keep your spirits elevated, because from my past experiences, and not just that, but something I strongly believe in is when your spirits are positive and you and your nerves are calm, I feel like you give yourself a more of a fighting chance if something were to happen. God forbid, but I feel, but I feel like if something were to happen, you go in with your nerves calm, you go in with positive spirits. I feel like you give yourself a fighting chance if something bad were to occur. Now, reflecting back off of my first back surgery experience when I had my 14-hour surgery, is I lost a lot of blood at the time, and I strongly believe, this is just one experience of dozens, I'm not exaggerating, of dozens of surgeries of mine, and I strongly believe that while I was losing blood and things were not looking too good for me, because of my spirits were positive and because I went in with my nerves calm, because I saw my doctor prior to, I saw the medical team prior to. They reassured me everything would be okay and that they were going to do their best. Now, they cannot make promises, right? But, they can reassure you like, hey, we are going to do the best that we can, right? And that, calms your nerves a little bit. And don't be afraid to ask questions. But I strongly believe, because I went in, my surgeries, procedures, with my nerves calm and my spirits positive, I feel like I gave myself a much more of a fighting chance to endure the surgery than if I hadn't. I did wake up in the ICU. I did wake up with blood transfusions, but I did pull through everything. I did pull through. Everything did turn out to be okay. The recovery process took a very long while for me. This is just my case. But again, don't be afraid to ask questions. What does your recovery look like? Don't be afraid to ask depending on what it is you are going through. Don't be afraid to ask, what's the recovery rate for other individuals who have gone through what I will be going through? What steps will I need to do after this surgery, this procedure? What can I expect after? And they will share with you, the pros and the cons of it. And don't be ignorant, by not looking at the cons, the worst case scenarios. But be optimistic. Have faith that all will be well. Everything will be okay. Especially when you are in a hospital that has a good reputation, with good surgeons, good medical team, good medical staff. Have faith, everything will be okay. I wanted to share this because I think someone out there somewhere, could benefit from this. Having surgery for the first time is scary. And I think knowing, that it is okay to ask questions and knowing it is okay to be scared is normal. You are not the first, and you definitely will not be the last. So don't be afraid to ask questions. I want to share this with you is this. It's a philosophy of mine that I have created. Is the difference between a person who knows the answer and the person who doesn't is the other had asked a question. Like the video if you gained value from this video. Subscribe if you are new, because I talk about mental health, cognitive development, and how to grow your faith spiritually. And comment down below advice for other people having surgery for the first time, what your experience was like, and let's try to keep it positive and optimistic for other people to read. I love you. I appreciate you. And remember, grow through what you go through. Much love.